Okay. They're coming in. Hi, everybody. Welcome. Thank you for joining us. We are just admitting people, so give us a second and then we're going to start. One person seems to be stuck in the waiting room. Okay. My name is Veronica Dialli. Welcome. I am a sourcing specialist for our talent acquisition in People and Culture Department here at UHN. And we started this series of the Let's Talk Nursing events back in September. And we've been really enjoying talking to the different departments and the nurse managers and nurses. And so today we're going to be talking to our team in transplants. So welcome, guys. Thank you for being here. Before I even go too much further, we have a special guest, Joanne Z, who's one of the clinical directors, I believe, right, Joanne? I could be getting it wrong. Yes, wonderful. Should have asked you that before we started. I know you're up there. Anyways, if you want to do your quick little welcome, that's completely cool, and I'll jump in after.
Thanks, Veronica. I'm Joanne Z. I'm the clinical director for Transplant, and I'm just a real pleasure and welcome you today to this session. There's nothing more exciting than to talk about our transplant program, and especially a profession and career in nursing and transplant. I think you're in store to learn a lot from our different leaders here, but I'll just say it's just a thriving environment to work in with amazing patients, and the journey that our patients take really in terms of life-saving and a second chance at life. So welcome today.
Awesome. Thank you so much for being here. You're the first director who's hopped on one of these calls, so I'm excited about that. So thank you for being here, Joanne. Okay, so I'm going to start a little bit with a bit of an introduction into what is UHN, what you can kind of expect as an employee of UHN, and then we're going to go and delve right into our transplant team. So just a little bit of a snapshot of what UHN is. UHN is a rather large organization. We are 25,000 people strong, probably more so now since our last count. We have 4 hospital locations, but actually in sites we have 9. So you may have heard of Toronto General, Toronto Western, Princess Margaret, and Toronto Rehab. Our Toronto Rehab has the most satellite locations, and we're very lucky to be the only organization really that has a school attached to it. So the Michener Institute of Education joined UHN a few years ago, which we're so grateful for, because we really do get an opportunity now to have a say in what it is the students learn and bring to our hospitals across the city. So we're super excited to have them on board. We have 7 research institutes. I'm going to show you a slide with a little more information on that after. 9 centers of excellence, 10 clinical programs that we do focus on, 2 foundations. So we have the UHN Foundation, which combined is a combination of the Toronto General, Western, and TRI foundations, and the Princess Margaret Cancer Foundation, which we all know and love and have at least bought a ticket once. I am still waiting to win my dream house or car. Hoping it happens one day, we shall see. And we do have some great partnerships with Altum Health, Healthcare Human Factors, Plexus, and Grand Challenges Canada. That really kind of rounds out what UHN is as a whole. So our vision is a healthier world, and our purpose is to transform lives and communities through excellence in care, discovery, and learning. And a little while ago, I am thinking 2015, although I'm horrible with dates. I have the memory of a goldfish. We got together in a room. We had 150 people come together in a room. We had patient partners, staff, family members, all come together and really dive into what it is that UHN's purpose, values, and principles were. And we landed on the following. So I just told you about our purpose, but our primary value above all else is the needs of our patients come first. And the values that we definitely value the most, especially when we are hiring people, we really look for people who have these things with them, which is safety, compassion, teamwork, integrity, and stewardship. So, and that photo, that was the launch of the program, and that's just me and my team having a little bit of fun with our favorite value. So what is Team UHN? As I mentioned, Team UHN is very large. We are 16,000 plus employees, 3,100 plus volunteers, and 8,000 students and learners. We are the largest hospital network in Canada. And our research hospitals were actually listed #1 in the top 40 research hospitals in Canada in 2021. And I believe this is the 4th year in a row that we've actually landed on the world's best hospital list for Newsweek magazine in the #4 spot. So great accomplishments we're very proud of. As Canada's top research hospital, as you can see, we are very, very large. We're fortunate enough to get $490 million in total research funding, and that goes to these 7 research foundations. And come on, we've come up with some of the most wonderful things in the world. It makes me proud to be a Team UHN member, even though I'm not the one who's finding them. I feel like at least I had a little bit of a say in hiring the people who got there. So just a little bit about our quality of work life at UHN. We try really hard to be very competitive and make sure that our total compensation package for employees is competitive to what's out there. We offer paid and unpaid leaves. We have great vacation plans. Well, we do have those too. Insurance plans such as extended health care and dental and disability insurance, etc. COVID definitely taught us that flexible work arrangements is possible, and that great work can be done from home. So for those opportunities where somebody is able to, remote work is possible. We have one of the best pensions in the province. The Hoop pension actually contributes for every dollar you put in, $1.26. So it's definitely one of the better ones. And if you work at any hospital in Ontario, you could just carry it with you should you change locations. So there's like no fuss, no trouble. Where we really try to look out for the well-being of our employees. So we do have great employee and family assistance programs. We have gyms on site with fitness classes. And those are very affordable compared to what you may pay outside. And for our work-life harmony, just highlight a few of the things that we do have. We have discounts on site for our gift shops and pharmacies. We have Bring Your Kids to Work Day, which unfortunately was put on hold for COVID, but I hear might be coming back this year. And we are very, very highly sought out when it comes to our programs for professional development. We offer quite a few different leadership programs, 25% off at the Michener Institute. So if there's anything that you want to take there, we have tuition assistance programs, and we do great long service tea ceremonies as a recognition piece. And when COVID wasn't around, we had this great summer barbecue where everybody got together, and the holiday. So we try to definitely recognize our employees as much as possible. Just to show you a little bit of the leaves close up, just a little while ago, there was actually a trend on our socials that was called Show Us Your Leave. So we did create a little video. If you're curious to watch it, please feel free to hop on our LinkedIn, and it does live there. But we have pregnancy and parental top-up leave up to 85%, 5 family days off. We have paid sick days, and I believe there are 5 emergency leave days that you can take off, such as bereavement, etc. And I believe I talked already a little bit about the benefits that we have. And just a few extra perks of working at UHN is that when you are in the hospitals, most of our hospitals are downtown. So we're in the heart of the Discovery District. We're never too far from you finding a great place to eat during your break if you can sneak out. We have a wonderful Emerging Leaders program that's very competitive. And I believe 50 people get in every year. But it took me 3 years, but I got in, and it is very much worth it. You learn a lot. One of the really fun things we have is the UHN 50/50 Lottery Raffle, where UHN gets half of the proceeds and the staff member does. And I believe that's something ridiculous, like $30,000 these days. So definitely still waiting for that one too. Because we are such a large organization, corporations do work with us to give us employee discounts. So there's just a few photos there of like different organizations that offer UHN members discounts. And the last thing I think I want to show you is that we have plenty of committees that you can join as well. So, working is one thing, but then, having a passion on the side and meeting with like-minded people in your workplace to work on something extra can be very rewarding. So we do have a green team. We have wellness ambassadors, the LGBTQ plus community, our Black history community, joint health and safety. There are so many associations that you could be a part of and really, develop more of your skills with at UHN. So you may be wondering why you want to choose UHN. I think I gave you a lot of reasons, but I'm going to count on our transplant team to tell you why you may want to choose a nursing career in transplant. So I'm going to stop sharing and I'm going to pass it over to Susan. So Susan, if you want to start sharing your screen, by all means.
Thanks. Hi, everybody. I'll just introduce myself first. My name is Susan Kiernan. I'm one of the nurse managers for the inpatient transplant units. My partner in crime is Marcia Cameron. She's actually off, unfortunately, with an emergency family situation, so couldn't attend today, but she definitely wanted to be here. So you hear my voice a lot. I hope it doesn't bore you too much. We're going to pull in a couple of the post-transplant coordinators to talk a little bit about their role in the transplant program throughout the slide deck, so you'll get a little break from me. And what else can I tell you before I start? I'm not the best at Zoom, so it might take me a few minutes to figure out how to share my screen and do all the proper thing. So I'll start working on that now. Hold on. Okay, step one, share the shiny faces. Is it gonna work? Share, click. Okay.
It's working.
Is it working? Fantastic. Now I have a question. Can you see just the picture, or do you see all the little pictures on the side?
We see all of them. So if you want to hit the present button, we may only see the big one.
We'll try that now. So I've hit the present button. Nothing is happening. Let's try again. Okay. Now how are we?
We're good. We see the next slide, but that's fine. You can definitely go.
If you're okay with that, we'll just leave it as is then.
Sure.
Usually I can make it share the whole screen, but I'm not always that clever. All right. So the transplant program is very large, and our official title is the Ajmera Transplant Center. So you'll sometimes see the initials ATC used, and that's what that stands for. We have 2 inpatient units. Well, let me go back. I'm going to start earlier on. We have a vision and a mission just for the transplant program. Our vision is that we want to be a world leader in transplantation, and we're definitely achieving that goal as the largest transplant program in Canada and one of the largest in North America. So we really are some of the most innovative, have some of the most innovative practices here at TGH, and it's quite impressive. So we have a mission to be a model for innovation, for excellence in clinical care delivery and research, and to be highly sought out for our educational opportunities. So that is very true. And it also, within nursing, we also are quite highly sought out for our educational opportunities, as well as for the, often people think this is only about physicians. It is not. We have some very strong relationships with some of the universities, and it's quite hard to get a placement here actually as a final year student. But we are a good place to begin your career. The team, we're a large group. We're about 630 people working in various capacities, as you can see on this list. I'm not going to read it out to you because I'm sure you can all read it yourselves. And we'll go through what some of these roles are from a nursing perspective in this presentation. So the units themselves, the inpatient units, they're on 2 wings. We have 7 wing A and B and 6A. So the 7th floor is a little bit larger. We're about 54 beds, and the 6th floor is 27 beds. I manage the 7th floor, and Marcia manages the 6th floor. So we work very closely together, though the nursing teams are officially separate, and you have your own manager. We're very collaborative. The 7th floor includes 16 level 2 ICU beds, which we often refer to as acute care or step down beds. So these are beds where patients are moved after they've come out of ICU and they've had a long stay. They need a higher level of nursing care. They do get heart monitors and arterial lines. And the nurses who care for the patients in this area have had a specialized training, which I will review for you as we go on. The 6th floor has its own speciality. They are a 20 to 28 bed, depending on the busyness, size unit, but they also manage a transplant day unit, which is on the 12th floor, and the nurses rotate through that unit and have an experience of managing patients in a day capacity and getting off their night day schedule for a little while, a little break, and just doing something new. So it's quite an interesting place to work. They also have a nephrology population on that unit. So the nephrology population is fairly small, between 5 and 8 patients generally as inpatients, but the nurses on 6A specialize in peritoneal dialysis. And so they also help support peritoneal dialysis throughout the organization, but also will go over to Princess Margaret or Mount Sinai to support that skill in the capacity of the PD or peritoneal dialysis off-service nurse. So that's another skill they have on the 6th floor. The types of transplants that we do are solid organ transplants. So these transplants are all the solid organs, and this is very strange setup compared to most transplant centers in the world, actually. So we care for patients with heart transplant, lung, small bowel, liver transplant, kidney transplant, pancreas transplant, and combination transplants such as kidney and pancreas together, heart and lung together. We also do small bowel transplants. I think I mentioned that already. And occasionally we've been doing islet cell transplants, and we're doing more and more of those. And that's some of the innovations that we've been, I'll talk about a little bit later on. There has been a hand transplant at UHN in the past, though that is actually managed through the Western Hospital because they have the expertise in limbs and over there that we do not have. But we do the organs. No bone marrow for us. That's at Princess Margaret. So the way the unit breakdown works, 7A and B tends to manage the majority of the immediate post-op transplant patients. So the patients who've come in for a transplant, gone to the OR, and have either returned directly back to the ward or have gone to the ICU and then come back to the ACU and ward, the step down in the ward. 6A, the majority of their patients are patients who are admitted with transplant complications or nephrology patients. And they also, of course, have the transplant day unit in their cohort as well. We do train the 6th floor nurses for the level 2 beds as well, though, so that they help man 2 of the beds up here on the 7th floor. Our ratios are generally 1 to 4 in the day shift and 1 to 5 at nights on both units. But the ACU or level 2 beds is a 1 to 2 level ratio. So it's more because it's more of an intensive care or intensive type of nursing that we're doing in that area. If you come to us, why would you want to? Well, there's a lot of reasons, really. We have a great capacity for teamwork and supporting of new hires on both of these units. You'll find if you're somebody who likes to work in a team environment, you are interested in people asking you if you need help, you are able to offer help and graciously have it received by others, then this is the right place for you. If you're someone who prefers, and there's no shame, this is the way some people like to work, to come in, get your job done and go home and not really interact a lot or feel perhaps offended if somebody offers you help, this is not the place for you, because everyone will offer you help. This is part of the culture and part of the expectation on the unit. We really, really have a strong team here, and it's a group of nurses who really like to support the new nurses coming in. So I just want to put that out there right at the beginning. We do have a week-long transplant orientation that's in class, where you learn about the different types of transplants and different medications. We have various people coming to speak to you, pharmacists, the different nurse practitioners from the different organ groups coming to talk about the complexities of lung or liver transplant. We have the discharge coordinators coming in to talk to you, and it's a nice interactive week-long session led by our nurse educators. 6A has some additional training regarding the peritoneal dialysis, but that's generally not done right off the bat. That's done after you've been working for us for a little time, and then you'll eventually get trained on those skills. For your buddy shifts after being hired, it really depends on where you're coming from. If you've done your final placement with us and you've been working with us for 3 months, then you're probably not going to need a lot of buddy shifts. We'd like you to have some, because there's some skills as a student you're not able to do when you're doing your consolidation. So we like to make sure that you're comfortable doing some of those skills like starting IVs and drawing blood that you're not allowed to do when you're a student. People coming in from the outside who haven't had a transplant experience, we look at your final placement experience. If you've been on a medical surgical unit or a GIM unit where you've had 4 or 5 patients in the daytime, you've managed a lot of hands-on basic nursing training, you may be able to get away with 12 or so shifts, buddy shifts, and then you'll probably feel comfortable to take your own assignment. If you're coming from a background where perhaps you haven't had a really solid final placement, not everyone's lucky with their final placement. Maybe you were in a nursing home, not that that's a bad thing, but you may have not had that acute care experience and had that chance to do full physical assessments and some of those things that are really key. We might give you longer, so a minimum of 14 shifts, and definitely with the opportunity to extend that. There is the opportunity for new grad initiative as well if you're a new graduate, and that would actually extend your buddy shifts to a total of 3 months. So we have some flexibility with our training. We like people to be ready to go at about 14 shifts, which is approximately 3 weeks, but often, actually 14 shifts is actually a month, sorry. 7 shifts is 2 weeks, so a month is 14 shifts. But if you need a little longer, there's usually a way we can work that out, and we're very supportive. The specialty skills that we learn are some of the complex surgical care skills. We have epidurals, we have lots of tubes and drains. Everybody's got a catheter, chest tubes, other types of drains in the bile duct, and drains often near the kidney if there's some kind of bleed near the kidney. We have very specialized medications, and they're very complex, and that we do have some special classes for that. And then once you've been with us for a while, we do the level 2 education, which is done at the Michener College. I'm going to talk about that when I get to the career path. And this is our career path. So we developed this career path to keep our nurses engaged and always learning on the transplant unit, which actually isn't hard at all because there's a heck of a lot to learn here. We like you to come to the ward for about a year. And in that first year, near the end of that first year, we generally ask you to be a preceptor, either for a new hire or for a final year student. And you may say to yourself as a new grad coming in, 1 year, like that's so new. Why would I want to be a preceptor at that short time? Well, the reason is that after a year, you've actually gained a lot of knowledge and experience, though you may not really quite know. And when you have a student come to work with you, not only do you remember being in their shoes and being a student and remember what it's like to be coming on the unit scared and trying to learn something new, you also start to give that knowledge to your student and show them things and realize and consolidate your knowledge that you are actually doing extremely well and that you are able to manage these patients and mentor somebody else coming through the system. So we found it very valuable, and I think the nurses like it too. We generally have more volunteers to work with students than we have students, so people really do like to foster a mentoring and coaching type of environment here on the unit. Once you've been a preceptor, we will look at whether you're ready to go for the L2 training, which is not automatic, but we generally look at between 1 year and 18 months for you to go to your level 2 training. That's done at the Michener at our new Institute for Education we have related with the UHN. And it's a 7-week course that we pay you to go. The cost for me as the manager to send you to that course is about $12,000 to $15,000 because it's expensive to pay people's fees to go. I also pay the instructor to instruct you. So it's an investment that we make, and we do it very happily because we find it extremely valuable for your nursing, and your nursing skills really improve after taking that course. It's like the first half of the ICU course that you're taking. And also then we can start rotating you through our level 2 beds on 7. Once you've taken that L2 training, you would then start to be someone who could be what we call it the resource nurse, but it's like being the ACU in charge, someone who's helping out with new ORs coming back. Like you don't have an assignment, you're assisting with people who need help or covering breaks or assisting patients going down for tests. So that's another role that will be the next step in our pathway. I've sort of skipped the PD branch. I'll get into that in a minute. Then a little later than that, you would be trained for in-charge. And we don't generally train for in-charge until you've been nursing for 4 to 5 years. It actually takes some time before you're ready. It's a big job. On the 6th floor, in the meantime, between the ward and the ACU or level 2 training, you would learn how to do peritoneal dialysis and learn how to be the off-service nurse. So just before you would be trained for in charge. Why UHN? So this is great. This keeps my nurses very interested and engaged, usually for at least 5 years, and many of them stay. We have many career nurses who are here on the unit who are telling me they're not going anywhere. They're learning new every day. They don't want to go. But sometimes after 5, 6 years, a nurse says, you know, I think I'm ready for a change. I think I want to try something new. And we do have a lot of opportunity at UHN. So we have 4 very large ICUs, and our unit is a bit of a feeder for ICU. So if you think ICU is a path that you might be interested in, this is a great place to start and will give you a very good foundation. We have no qualms with getting our nurses into the ICU because you'll also manage the transplant patients there as well. And we think it's great that our nurses go into those roles. But there's many other opportunities. We have a very large ambulatory transplant program, which is connected closely to our inpatient program, who manage transplant patients when they've gone home, and also prepare transplant patients for transplant, so pre-transplant patients, I guess you call them. There can be opportunities to do coverage of mat leaves or secondments in some of these roles. I'm going to show you a list of them in a minute. And I'm also going to ask some of the coordinators to talk about what the jobs entail. We've also had nurses seconded for things like quality specialists and advanced nurse practice roles in various areas throughout the hospital. There's a lot of innovative positions and a lot of opportunities. We also have things, I'm just going to backpedal a little bit just for interest during your time on the ward. We have many other interesting things at UHN. So there's a program called CAP Fellowship, which is when any nurse from a brand new hire to a 20-year experienced nurse can choose an idea or a quality improvement idea that they see a need for. So say you think, you know, I think we're not doing really great mouth care on our patients. I think we need to improve that. I noticed this is a gap. So you can submit a proposal to the CAP Fellowship team. They'll review it. If they accept your proposal, you'll actually have 2 days a week paid to work on that quality improvement project and training on how to do a quality improvement project for 6 months, which is absolutely incredible. And we've had many nurses go through this program and really come out with some awesome changes and practice changes on the unit. It's been quite phenomenal. So just letting you know about that as well. That's just one of the many interesting things. So some of our advanced opportunities, ambulatory transplant program, we're going to have some people speak to that. The MOTC group, multi-organ transplant coordinator, that stands for. This is a group of nurses who specialize in the management of patients who are being called in for transplant today and organizing the whole back work of that. So this involves speaking to Trillium Gift of Life, helping sort out the donor or the organs who are coming and the donor who is donating those organs, not actually sorting out the donor, but just taking the information about the donor, passing that information on to a surgeon, helping with the decision making. Are they accepting the organ? Do they need more information? Then they would help with figuring out who's getting the organ, contact the person who's getting the organ, help coordinate them coming into the hospital, organize the OR, and many other pieces that we don't really see when we're working as nurses on the ward, but this is all stuff that's happening in the background to make this go forward. So we've had many nurses go through a year there, either just to be seconded to help out for a year, or who moved there as permanent positions. So that's another group, another interesting role that's within the program. And then we have the ICUs, which I've already talked about. So first we're going to have BJ do a little talk about being a pre-transplant coordinator and tell us what that job entails.
Hi, everyone. Thanks for the opportunity today. I'm so glad to be here. So I'm BJ Realbit. I'm a registered nurse. I work as a clinical coordinator with the pre-kidney office here. In terms of my relationship and history with the program, I actually started as a nurse here almost 20 years ago now. So I've sort of come full circle, spent some time here for about 5 years, worked in the step down, worked on the unit, worked as a resource nurse in the ACU, and then sort of went off and did a couple things for about a decade, and then made my way back. In terms of the role I do now, I work with patients who are newly referred for kidney transplant, really trying to work with the patient as well as their families to educate them about the transplant, sort of the benefits and the risks, the process of assessment, really coordinating all of those tests and assessments, those checks and balances that we need to make sure that the patient is safe to proceed. So we basically get the referral package, review it for any red flags in terms of any issues with or concerns that may pose an issue for transplant. We identify issues in terms of what we can optimize. So really we want the patient as healthy and active as possible prior to transplant, because this means a quicker recovery post-transplant. And really in terms of the long term, it increases their chances of really having a successful outcome. We work closely with the social worker, the physicians, the surgeons, really trying to make sure that there aren't any surprises at the time of the surgery. And then basically with the guidelines provided by Trillium Gift of Life, we really try to identify any of those absolute or relative contraindications for transplant. Once the patient is listed and approved for transplant, we as pre-transplant coordinators also manage patients on the wait list. So whether it's a couple of weeks before their living donor surgery or in terms of a deceased donor transplant, many of our patients, as you know, can be waiting for 5 or 7 years for a transplant potentially. And so we want to make sure that that patient, when they get that call, are going to be ready and safe to proceed. And like I said, we continue to support the patient and family, as well as our referring partners in terms of supporting this patient throughout their journey. It really is an interesting role, definitely a lot of growth, leadership opportunities, a lot of quality work that we get to do in terms of trying to streamline and find efficiencies in terms of what we do. There's certainly not a lack of patients, a lot of referrals. We get 1 to 2 new referrals every day, manage about 1,200 patients right now amongst the team through their evaluation in terms of the kidney world. And there's another 400 or 500 patients active on the transplant waiting list. All of the organ groups differ slightly in terms of how they manage and follow their patients. And so again, it will depend on their organ group. So that's sort of a brief snapshot of what we do in the pre-transplant office. And again, it really is an exciting place to work, a lot of growth and opportunity. And like Susan said, there's definitely no lack of teamwork here. And it really is a great place to be.
I'm wondering, one of my colleagues was trying to join the meeting. She had to come a bit late because she was doing a teaching class for the new orientation. I don't know if you see her name popping up on the waiting room, Veronica. If you're able to let her in, that would be great. Her name is Tatiana. Thank you. She just texted me to ask. Next
in now.
Thank you. That's very nice. Next, we have Brittany Coles, who's going to talk to us a little bit about the post-transplant coordinator role and her experience there.
Hello, hello. My name's Brittany. I'm currently looking at a blank screen, so if you see me like looking back, it's because my screens are all out of order. But anyhow, I'm one of the post-transplant liver coordinators. I have worked in this role for the past year. And I've worked for UHN for the past coming up on 8 years in September. I started on the floor in GIM back in 2014, and then we switched over to transplant. All the roles that Susan had talked about, I've actually had the opportunity to do. So I started off as a floor nurse, and then I worked on 6A, and my ladder to how I got to a coordinator was a little bit different from the pathway that she had shown you, but that was specifically just because we were a brand new unit and needed the nurses to do the training stat. But I started on the floor, and then I got trained in PD dialysis. And then I think day unit was next, which was great for a couple of years. Then in charge. Then I went over to the ACU course that Susan had mentioned, and she's 100% right. It is definitely a game changer in your career, I think, when it comes to you and your practice. And then I moved over to the coordinator world because I found I was very intrigued by what they did. So like I said, I work in the liver transplant coordinator world. It's a great team. One of my other colleagues is on the call as well. Her name is Shauna. Wave a hand, Shauna, or not. But yeah, there she is. There she is. And yeah, we have a good solid team. We look after the patients after they've had their liver transplant, monitor their graft, and interesting role because there's a lot of autonomy. You work very closely with the different physicians and different healthcare teams, and takes a lot of organization and coordination to do this role, but it's very interesting for your practice, very important for your practice, very different world from being on the floor. So obviously transplant offers quite literally everything.
Thank you, Brittany.
Yes.
All right, so I'll keep trucking through and we will give you time to ask questions at the end. So just so you know, everybody. All right.
Susan, I just want to mention one thing about the coordinator role. There is a podcast episode with Shauna, because she's so silent. And just if you want to know more about the coordinator role, you can listen to it, and it'll tell you everything you need to know about what we do.
I don't know if there's a place we could post that link to that. That would be helpful, Brittany. If there's a chat or somewhere that we could post it, or perhaps you could forward it to Veronica.
Yeah, I can put it in the chat.
Thank you. That would be lovely.
No problem.
So what's happening at the Ajmera Transplant Center? Well, some things that are happening is definitely we're doing more and more transplants. So the activity is increasing. We are doing around 600 transplants a year of the various types. We are really running out of space. We need to grow. There's some plans to expand ward space. There's some plans to expand the level 2 space. I'm going to go through them with you in a minute. We're looking at, we very much support people doing extra certifications, such as your GI nursing certification. We are happy to assist with looking for innovative positions or secondments around the hospital and organization, as also within the transplant program, if you have an interest. And we like to rotate, keep people rotating through the roles so that we can keep people engaged and interested and learning every day, because that's part of what keeps your job interesting. So a few highlights of 2021 and the expansion of the L2 beds comes into these highlights. Really, I cannot tell you enough that this is a nice group of people to work with. Oh, and I'm just going to decline that. There we go. So very friendly, very open, very welcoming, and very supportive of new staff. So we do not see this, you've probably heard about it in your nursing school, the culture that you hear of in nursing where nurses eat their young. That is not a thing here. We do not have that as a cultural thing. It's a group that really embraces people and helps mentor and support them through their work life. So this is some of the staff from the 7th floor. And this is some of the staff. This is Marcia in the middle, standing with her board there, her wellness board. She's the manager for the 6th floor. And then some of the 6th floor staff wearing their green shirts in remembrance of the Humboldt's hockey team. And we have a couple of our discharge coordinators. That's another role that I didn't actually mention as well that we have on the unit. They are nurses who help support patients who are going home post-transplant. There's very specialized transplant education required when you go home. And also many of our patients become diabetic, and these discharge coordinators, and we have Arlene and Rowena in that picture in the left-hand side, are the ones who do that education for us to help get these patients home safely and help coordinate the complexities of getting these guys home. It's not an easy task. So this is a little video I'm going to play in a second, and it is of, it's not actually human organs, they're pig organs, but there's been development and innovative development over the years, first with lung of a machine called an ex vivo machine. So the idea is that the lungs are taken out of the deceased donor body and placed in this machine, and they're perfused with blood and oxygen, so kept basically breathing on the machine in order to facilitate a better outcome when the lungs are transplanted. So the thought is that there could be an idea of improving the lung to give, say, antibiotics if there was an infection, if the donor had pneumonia or something like that, before the lungs are transplanted, or to look to see if the lungs are able to oxygenate well, and test them really before they're transplanted to see if they're usable or not. So this has been a huge innovation. It's used now all over the world, this ex vivo lung technology that was developed here. They've also developed now a liver ex vivo machine. They're working on a kidney one, and or the kidney one may be ready, I'm not sure. And the pancreas one is new. And there's a heart one they're working on as well. So this is the, so it's heart, pancreas, liver, lung, and kidney. And this is all 5 going at once. I'm going to play it for you. So there you go. Traditionally, organs are just sort of basically put on ice until they are transplanted, which doesn't give you a lot of time. So when I was a transplant staff nurse 23 years ago, and somebody came for a lung transplant, you had to get them ready to go and be in the OR within about 2 to 3 hours, because the lungs couldn't wait. They were taken out of the donor and they had to be put into the recipient. So it was a really fast, frantic situation to get people ready. Now, because of ex vivo, the lungs can be kept for a longer period of time, and better perfused and oxygenated and placed in the patient for a better outcome. So it's really a very exciting advancement. Oh shoot, I didn't mean to do that. There we go. Also wanted to promote some of the other nursing roles on the unit. We do have a lot of nurse practitioners, and this is a picture of, there's 3 of our nurse practitioners here. The one I believe has just moved on. Shafrina in the bottom left has now gone on to do some further education, but she was one of our kidney transplant coordinators, nurse practitioners rather. Nikki Marks at the top there is one of our lung transplant nurse coordinators, and Stella is one of the heart transplant coordinators, who also has actually moved into a different role within the heart program, but was with us for longer than me, so probably 25 years in transplant at least, before she's now changed her job to something slightly different. The patients, so those NPs do a lot of work and have been very successful in leading programs throughout UHN. Nikki is very instrumental in the management and care of the COVID patients, both all patients with COVID, but also transplant patients with COVID who are particularly complex. And Shafrina, I think in this, had won an award, and Stella has been heavily involved in the management of the heart patients, which has been, really making differences in people's lives. The patients themselves are very grateful and recognize the stellar nursing care they get here. They want to come here. They are often very reluctant to go to their local emerges, I will tell you. They want to come to Toronto General because they know that the care they get from the nurses here is excellent. And you can see from these quotes, these are all things that patients said to me either in a letter or through patient relations to let us know their thanks. And I just thought I'd put a few of them on here. And I think one of the, some of them I really noticed, like the professionalism, skill, bedside manner, clarity, and overall care that permeates. And I think that's really true. And it's not just nursing, it's everyone. But one of the comments in that quote was saying how nursing explain what they're going to do and ask, is it okay? Can we go ahead and do this now? And that was really important to the patient, to be given some autonomy in their own decision making. And when they can, there's not a lot, you don't get a lot of choices when you're in the hospital. So they appreciated the nurses taking that care. So the proposal for the expansion went in some time ago. And this is a little graphic. It's going to be on the 11th floor, which is currently offices. They're going to gut the floor and put in 30 beds, 6 of which will be ICU beds, level 1, 24 of which will be ACU or level 2 beds, which are the ones that we'll be managing that our nurses will be managing. So it's going to be very nice, all private rooms, all set up with an ICU level of setup so that it's good visual of the patients, and obviously all the other things we need for the appropriate negative pressure rooms for patients with isolation, and all the monitors and care. So it's very exciting. It's a huge request that we're making for the government to pay for this. So, and we've also raised a huge amount of money from philanthropy to help pay for it. So it's very exciting. So we're hoping to see this come to fruition within the next probably about 4 years, I would say 3 to 4 years. This little story I just wanted to tell us to end us off. This is a story of a little boy who needed a liver transplant in a hurry. So his liver began to fail unexpectedly, and he was at Sick Kids and in critical condition. His mother was offered to donate part of her liver, obviously, to save her little guy. And the team really made an incredible thing happen in a short period of time to do this. And this was a real example of everyone working together from the pre-transplant side of things. In this case, it was the pre-donor transplant side of things, because we didn't have the recipient. The recipient was at Sick Kids, but sometimes this happens with an adult recipient too, and we're managing the recipient as well, who had to work up this lady. It's very complex. There's a lot of testing, a lot of specialized blood work. It meant people coming in on Saturday to do it and make sure that the right labs were getting the right things at the right time, and that people were coming in to do the testing. So the mom was cleared to be a donor. The surgery was arranged. We got her in. We got the little guy transplanted, and he did amazingly well. And he would have died if we hadn't been able to get him transplanted in a timely fashion like that. So that's just a little example, and there's such cute pictures of him that I couldn't resist putting them on. That is the whole presentation, everyone. And I'd really be interested to answer questions if anyone has any. I'm going to stop sharing my screen so that I can see if you're talking. I might be able to see your name or your face, which would be very nice. See if I can figure out how to do it is the real question.
Awesome. Thank you so much, Susan. That was a lot of information, a lot of good information.
It's very long, and I still haven't figured out how to stop sharing. I see new share. Oh, there, stop share. There we go. All right.
Beautiful. So if anybody does have any questions, please feel free to put them in the chat or unmute yourself, whatever you feel more comfortable doing. I'm just trying to, I did open up a Slido earlier this week to figure it out. So I'm just logging in to see if we had any questions there. But you guys can go ahead and unmute yourself or ask any questions you may have.
Maybe we did such a good job, nobody has any questions.
Sometimes people are shy.
I think you've already heard that we're the best, so you should come and work with us. So I think that if anyone wants to speak, just jump in, but I'll just chat a little bit more. But I think Veronica's going to be sending you some links, those of you who've joined us, with the opportunity to apply for a position if you're interested, and then we'll be able to contact you for an interview. We definitely do like to do an interview. We'll definitely want to talk to your preceptor from your consolidation experience. If that's if you're a new grad, if you're somebody who's working somewhere else and you're interested in coming here, that's also interesting. We're always happy to learn from other people's experiences. If you worked in orthopedics, that doesn't mean you don't have great care to bring here. We're happy to have you, but we will definitely want to give you some buddy time and make sure you're comfortable in the new world. We wouldn't just throw you in without help. So just so you know, I think that's coming. And then you also are welcome to always contact me directly if you want to. Everyone's emails are the same. It's basically first name dot last name at uhn.ca. So it's very easy to find people. You can always send me an email. And I'm happy to chat on the phone too, if there's something you can think of.
Susan, I don't know if you mentioned this, but do they still offer the new grad initiative?
Yes, I did. I did mention a little bit, but I guess I could explain a bit better what it is. So the New Grad Initiative is a program where you actually get buddied for 3 months. So it's almost like doing your consolidation again. So it's pretty excellent, actually. We do it with nurses who are coming from maybe a very far away from a med-surg type background. And sometimes ones who've had the med-surg background but are like, I really feel like I need a little more time. We'll use it. And then sometimes we don't. It just depends what people are ready to do. Some people are really ready to go on their own, you know, like they want to get comfortable, but then they just want to get to it, which I get. I was that nurse as well. I didn't want someone hanging over my shoulder all the time. I was happy to ask for help and receive help, but I kind of wanted just to do my thing and figure out my way. But we will support your learning, whatever works best for you. So
I did the New Grad
you
Initiative.
did that, yeah. Was that with 6 or was that with NRT?
Yeah, that was with 6, but I had done like a thoracics, I guess, consolidation, and then started on like in medicine with the New Grad Initiative, and I needed it.
It is great.
So, it is great. I was terrified, but yeah,
I think
good that they still have it.
But I think that's something that we all have to know, you know, when you're coming into a new job, wherever you end up, and there's lots of opportunities at UHN. So maybe you won't end up with me, but maybe you're going to end up somewhere else at UHN in an exciting job. But everyone's going to be scared. You're going to be scared coming into work as a nurse. It's a scary job. You have a lot of responsibility. You're going to come in, you're going to feel sick every day when you come to work. I did for 2 years. Like, honestly, it's a scary job. And you say your little prayer on the way and you say, please don't let me kill anyone today. And you come to work, and that's actually really what you do. And nobody tells you that in nursing school. But that's so we all do it. But if you come full time, if you can take a full-time job, I have part-time jobs available too. If anyone out there's interested in part-time, I'm really happy to hire part-time as well. But I do have full-time jobs as well. You'll find you consolidate your skills and your comfort level a lot faster. You'll be comfortable within a year. You'll stop feeling sick. If you come part-time, it'll take you a couple of years. That would be my advice to you. So I don't know, don't be scared of coming. Come and embrace your nursing career going forward, and you'll enjoy it. It just might take some time to get used to it. It doesn't mean once you're there, the sick feeling stops once you get started, like in the day even. It's only the going to work. It's nerve-wracking.
I'll say the team is the only reason that really made me continue to stay, because I was terrified for a significant portion of the first year of nursing. But the people I worked with were obviously great, and to this day still continue to support me. So
yeah, the teamwork is quite impressive, and many of the post coordinators and pre-coordinators are ward nurses who moved into those positions, such as BJ, such as Brittany, such as Shauna. I'm not quite sure who all is on here because it's I don't get to see all the names when I'm looking. Francis just joined us. Francis is our current nurse educator. We have Carlin on here. She also was a staff nurse.
Eleni.
Yeah, so I actually have an interesting story with my start of my career. I started nursing in 2013 with the UHN through the NRT, so Nursing Resource Team. And I also was a part of the New Grad Initiative as well, which I think it's an amazing program for new nurses because you're buddied up for 3 months with an expert UHN nurse. So you really do learn a lot. But then as an NRT nurse, you actually have the opportunity to specialize in certain areas within the hospital. And one of those is transplant. So the transplant team does welcome you in with open arms. And so they did that for me. And I think I do remember working with Shauna once or twice, it's very vague memory. But I was there, I was transplant trained. And so it was a great opportunity. I did leave the NRT team a few years later after that and worked on a surgical unit. But then I made my way back to transplant as a coordinator for covering different mat leaves. So that's another way. If you do not necessarily go into transplant initially, but if you go into NRT nursing, then you can also segue into being a transplant trained nurse that way, and then get your foot into the door, get that transplant experience, and see what that world's about. So it's another good opportunity.
Oh, that's great, Carlin. Thank you for sharing that.
Shauna, how'd you start?
I've been at Transplant my entire career. So as a U of T nursing, my consolidation was on Transplant. I was lucky to then get hired on Transplant. I worked there and I did the career path that Susan just mentioned. I did a CAP fellowship, I did ACU, resource, in charge. And then when I was doing my master's, I then moved up into the ambulatory world. And now I'm still in Transplant, but in ambulatory. So yeah. It's a good place to work. I don't know if anyone, we're talking a lot. Does anyone in the audience have questions for us?
Yeah.
There is one in the Slido someone sent in. They said, I actually had a friend who is an employee of UHN who became a living donor.
Cool.
His story was so inspiring that it makes me want to try nursing in transplant. I'm wondering what you guys can tell me about the living donor program.
Oh,
Good question.
great question. So there's so much to tell you about the living donor program that there's hard to almost know where to start. From an inpatient nursing perspective, we do look after the donors. So after the donation happens, we do manage the donors on the floor. I didn't mention that. I mentioned that we looked after liver, lung, kidney, and heart patients, but I maybe didn't explain what the patients were like very well. So maybe I'll do that quickly. So we look after these patients after they have their surgery. We also look after them when they come in with transplant complications. So if they have some rejection or very serious infections, they might get admitted to the hospital. We also look after patients who've donated. So if somebody gives half their liver to their brother or their friend, then they would come to us as well, and we would manage them. And also patients who donate a kidney, we would manage between the units. And also patients who are waiting for liver transplant if they are very, very sick and require hospitalization. We manage those patients. We call them the pre-liver patients, and they come in sometimes quite ill. Sometimes they're our sickest patients actually, waiting for their transplants and end-stage liver failure. So that's the groups we look after. Vijay, you might be the man to talk about live donor. Is that correct?
So I work with the team that works with the live donor kidney team. I obviously work on the recipient side, but work really closely with our coordinators who work up the donors. And so they are really followed by an independent team just to make sure that there's no conflict of interest. Essentially, they get similar blood work, baseline testing, physician and surgeon consults, and essentially are medically cleared by the team. By the time they come through sort of through my door, essentially we're at the point where we're actually booking a surgery and preparing these patients to prepare for their patient admission, really doing updated testing as needed just to make sure that there aren't any current red flags. And then also, telling them what to pack, what to prepare, what to bring, what the visiting hours are, all of that stuff as it relates to the admission, where to park, where to go. So we do a lot of teaching up to that point as well. And then we hand it over to the inpatient unit.
Thanks, BJ.
So I'm going to ask just one question that I've heard a lot of people ask at other sessions, and I'd be curious to hear how your team would answer it as well. Sometimes young nurses or new nurses are a little bit hesitant about working on units where there may be a higher rate of patients getting seriously ill or passing away, and what kind of supports the team offers in that sort of sense.
Wow, that is a really great question. I've never had anyone ask me that question, so that's really good. I'll answer a little bit, and then I might get Francis, our nurse educator, or someone else, Tatiana, someone to join in as well. We do have patients who get very seriously ill here on transplant, and it's not an uncommon thing. However, I think you would find that the teamwork aspect of managing the patients really comes into play. So if your patient is deteriorating, you will find you are swamped by your colleagues who come in to help you support that patient. The patients are managed by their individual teams. So sometimes if it's a lung patient, you have to call the lung team, a liver, the liver team. So there's a lot of different doctors to navigate, so that can be tricky. But your colleagues in those crisis moments are definitely there for you. And maybe Tati or Francis could speak to that a little bit.
I could speak to it a bit. Yeah, so definitely when things like that happen, we also have like our charge nurse, our resource nurse. The role that I do is the patient care coordinator, which is more like the assistant manager. We jump in, and actually even across the units, because we're really like two sister units. We have 7AB, Sorry, I missed the beginning of the presentation, but I'm not sure how much you went into that, but we have 7A, B, and then we also have the 6th floor. And every code or things like that that happen, people will go and check on each other. So like if there's a code on 6th floor, I'm on 7, I'll run down and I'll check and make sure they're okay. So it's really collaborative that way. Like we won't leave you alone. We'll make sure that you're supported. And we have things in place to do that. But there's also very much a culture, as Susan mentioned, of just helping each other.
Thank you.
What I would add to that, Tati and Susan, just around critical care outreach team. So we work really closely with the ICU. They're sort of have our back all the time, and you always rely for their expert opinion in terms of that. But we have that program within UHN, which is fabulous, really supporting frontline nurses dealing with critical care issues, potential imminent codes or transfers to ICU, and really, driving on their ICU experience to support our team is really a fabulous resource here at UHN.
Thank you, BJ. That is exactly awesome and true. And it is, we find in transplant, though we do have patients who become critically ill quickly, often, not every minute, but it can easily happen. We don't have a high death rate. So that is one thing I can tell you. We generally do manage to resuscitate or rescue these patients, and often with the help of the CCRT, as sort of pre-code situation. So we find that the nurses here generally have very good assessment and critical thinking skills. They tend to notice when things start to deteriorate, and tend to be able to flag those situations for the physicians and nurse practitioners who are around. We then escalate to the CCRT, who will often come and assess to see if there's some interventions we might be able to do to help them here. We could transfer them from the ward into the step-down unit for a closer observation and closer management to the level 2 ICU, or they could be transferred directly to the full ICU. So we often will move patients from the ward into the ACU or the level 2 ICU beds. We're not waiting for a doctor. If we see they're deteriorating, we'll move them into that bed right away to support them with a higher level of nursing care. So there's a lot of support out there. So that was excellent, BJ. Thank you. If that was probably maybe more the answer the person was looking for, to be honest.
Susan, also just to build on what you said, I think a huge benefit, which Susan touched on, is on our unit, we have both ward nurses and then nurses who are trained to work in the step down as part of our career ladder, and you mix together, right? So not only is the step down housed in the unit, within the unit, but you have nurses that you're working with who have that experience of working in the step down. And I think that really adds to the assistants and the people that you can reach out to, because they'll help you track those things early. And you'll see something happening and you'll ask a more senior nurse. And I think it's just a real benefit to our patients that they have that added skill set to catch those things early and to intervene early.
I also think that the patients can be very helpful, actually, because our transplant patients are very aware. They've been ill often for a long time. They're quite savvy about their own illness process, their own bodies, what they're experiencing. And when people tell you things here, they're often correct. Like if someone says to you, I'm really having a problem with my breathing today, even though their SATs are good and they look okay from a visual perspective, you take them seriously because they know they're really savvy patients. So that is also some of the tricks that we have here that help. Anyone else have any questions?
I see no extra questions in the chat.
You guys are an easy. Oh, I see someone. Alison.
Hi, I was just gonna ask. Thank you so much for this presentation, by the way. And I wanted to ask, what kind of certifications would you want to see from potential candidates to get started in transplant? Because I don't really have any experience with transplant, but it sounds very interesting from this.
So mainly what you need is a license.
Yeah.
If you have your license, we will work with you for all the other pieces that you would need. So the transplant orientation, we would pay you to come and do that and train you, and you would learn about the medications and write the med test, and anything else like moving on into the level 2 areas, that would be further in your career. But again, we'd be paying you to do that. It wouldn't be something you'd have to do on your own. So some nurses will go ahead and take like CC1 or CC, like the cardiac courses on their own before they go to step down. Some nurses choose to do that just out of interest, really. But many of them just wait until they go to the step down course and take it then, because it's the same level of course, really. So no, there's nothing extra that you need. I just need you to have a license, and then we will support you to make sure you know what you need to know to manage the patients properly.
Okay,
Yeah.
thank you.
Yeah, great question.
Okay, wonderful. Well, I just want to say that, you know, your team has a whole Instagram account just for the Transplant Center, which is wonderful. So if anybody wants to see what they're doing and what they're up to and what they've done, definitely check them out on Instagram. And Brittany's podcast is amazing. She's been, she sent me a link, which I'm going to share on the job posting as well. And I'm going to share it on LinkedIn. So if you guys aren't on our LinkedIn, follow us on our socials at UHN Careers, and you'll get that there. I just want to close off by saying, like, I have a tremendous respect for what you guys do. I've been a patient. I've had 3 surgeries in the last maybe 10 years, and the nurses have always been the ones that made a difference. I mean, yes, the doctors do the operation, but the nurses are the ones who help bring you back. So I thank you guys tremendously for what you do. You're very, very valued, and I want you to know that your patients really, really do appreciate you. One last thing I want to say before we go is that BJ has the greatest hair of all of us here. So I like looking at him just because look at his great hair. He's inspiring me for wanting to do that with my son's hair. So thank you, BJ. I don't know if there's anything else you guys want to close off before we go, but any last words, any last thoughts?
No, I don't think so, but I'll hope to see some of your names come through, and then we can meet in person or have a conversation this one-on-one, which might be nice. And I'll try not to repeat all the same stuff again. You can just tell me to stop if I'm telling you the same thing, but I'd be very happy to meet some of you.
So next steps for those of you who are interested in a career in transplant, we are going to be collecting resumes. I will be sending out a link where you can apply with the video. If you found this information session super exciting and there's someone that you think of that would really enjoy transplant, you can send it to them as well and have them apply. And hopefully we will see you on the unit with these lovely nurses. So thank you very much, guys, for being here.
Thank you.
Thanks so much.
Wishing you all a wonderful evening. Thank you so much.
Thank you.
Bye.